Hi everyone, my name is Kirsty Woith and I will be giving you a presentation on oppositional defiant disorder, also known as ODD. Oppositional defiant disorder is a disruptive behavior disorder of children. The cardinal characteristics of ODD include obnoxious, aggressive behavior and an intent to bother and irritate people, particularly adult authority figures. As you might expect, the obnoxious behavior of ODD children tends to create problems with family and friends, both in school and at home. ODD children and defiant teens consistently refuse to follow commands or requests by adults. These children repeatedly lose their temper, test adults, and refuse to comply with rules and directions. Defiant children and teens become annoyed easily. They refuse to take responsibility and blame others for their mistakes. These children are stubborn and obnoxious, and even as young children, they test your limits and your patience. Defiant children and teens are extremely manipulative. Everywhere they go, they are surrounded by discord. They incite family members to fight with each other and in doing so, turn attention away from themselves. Most children are obnoxious and defiant during certain periods of their lives, particularly during ages of transition such as the toddler phase or the teen years. During these developmental stages, children and teens are testing their limits, so they normally act with defiance in order to assert themselves. At other times, normal children can act out with defiance, particularly when they are tired, hungry, or upset. This makes the diagnosis of ODD even harder. The difference between normal bad behavior and oppositional defiant behavior is a matter of the degree and the frequency. Children with ODD display difficult behavior to the extent that it disrupts their learning, school adjustment, and sometimes with the children's social relationships. Some of the characteristics that can be seen in children who have ODD include getting angry easily, arguing and talking back to adults, defying reasonable requests, bucking rules, intentionally bothering people, pushing their limits, not taking responsibility for their mistakes or their misbehavior, getting easily annoyed, getting angry easily and being resentful, spiteful, or vindictive, speaking harshly, being brutally unkind when upset, seeking revenge, and having frequent temper tantrums. Parents of ODD children usually describe these children as being rigid and demanding even from an early age. What are the causes? Unfortunately, we do not have a specific answer. However, there are a few theories as to why ODD happens. The developmental theory suggests that the persistent is really a result of incomplete development. For some reason, these children never completely develop the tasks that normal children master during the toddler years. They get stuck in the 2 to 3-year-old age range of defiance and never really grow out of it. The learning theory suggests that ODD develops as a response to negative interactions. These techniques used by parents and authority figures on these children bring about the disobedient behavior. The parents are not to blame when this happens. These same techniques work quite well for normal children. Here are some facts about ODD, and I will give you some additional facts as well. Oppositional defiant disorder usually does not occur alone. 50 to 65% of these children also have ADD or ADHD. 35% of these children develop some form of affective disorder. 20% have some form of mood disorder such as bipolar disorder or anxiety. 15% develop some form of personality disorder, and many of these children have learning disorders. Any child with ODD should be evaluated for other disorders as well. If your child's disruptive behavior is excessive, then you must find out if there are other coexisting problems. The key to getting a handle on ODD child behavior is treating these other conditions as soon as possible. Some teaching strategies that teachers can use to help students who have ODD is recognize when the student needs individual attention. They need to develop reasonable description of behavior and coping strategies. They need to make sure that they don't create a power struggle with the student. They need to provide a physical outlet. Sometimes these students can get very aggressive and they need a way to express themselves. Sometimes it's best to use humor with these children, sometimes not. It's up to the teacher's discretion. And it's always important to use positive reinforcement when addressing situations with these children. The parent strategies are somewhat similar to teacher strategies. They need to set clear expectations, communicate expectations of appropriate behavior and non-appropriate behavior. They need to use transition warnings. They need to give choice. They also need to offer positive reinforcement, and they also need to communicate with the teacher. Let the teacher know what's working at home and what's not, so that way the teacher and the parents can stay consistent all the way around. So what happens to children with ODD? Some will grow out of it. Half of the preschoolers that are labeled ODD are normal by the age of 8. However, in other children, 75% will still be noticeably defiant later on in life. The ODD may turn into something else. 5 to 10% of preschoolers with ODD have their diagnosis changed to ADHD. And in some children, the defiant behavior gets worse, and these children eventually are diagnosed with conduct disorder. This progression usually happens fairly early. If a child has ODD for 3 to 4 years and they haven't developed conductive disorder, then they probably won't develop it. The child may continue to have ODD without anything else. This is unusual, but by the time preschoolers with ODD are 8 years old, only 5% have just this condition and nothing else. And it's also very common for the child to develop other disorders later on in life. There's medical treatment for oppositional defiant disorder, as well as psychological intervention for children who have ODD. It's up to the discretion of the medical professional to determine what the best form of treatment is for these students. Here are the link to some of the resources that I've used if you'd like any more additional information on ODD. Thank you.